But we begin tonight with a mystery baffling our health experts. How did a Rydges hotel maintenance man contract a strain of Covid-19 from a hotel guest he apparently never came into contact with? Yesterday, the Ministry of Health confirmed the worker tested positive on August 16th, but the strain of the virus he had is not the same as the one linked to the Auckland community outbreak. Instead, it's the same as a returnee from the United States who arrived alone and left the facility in late July. Dr. Ashley Bloomfield says health authorities still don't know how the virus was transmitted because the man and the returnee never actually came into physical contact, although virus experts say human-to-human transmission is the most likely explanation. Our reporter Logan Church has been trying to put the pieces of the puzzle together.
Test results so far from people considered to be close contacts of the maintenance man at Auckland's Rydges Hotel have resulted in one piece of good news.
There are no additional cases relating to the Rydges maintenance worker that we talked about yesterday.
But how he got COVID-19 still remains a mystery. Here is what we definitely know. The maintenance man entered what would soon become the US returnee's hotel room 2 times in late July. Once on the 21st of July to fix the TV, and the second time on the 23rd to fix the shower. The woman arrived 5 days later on the 28th and stayed for 4 days before testing positive on the 31st of July and was moved to the Jet Park quarantine facility. That room was not entered at all for 14 days. Meanwhile, the worker attended 2 church services on August the 9th and began showing symptoms of COVID-19, which he initially put down to a pre-existing condition, on the 11th. The worker was tested on the 13th of August as part of routine testing, with a positive result returned on the 16th of August. Despite the infected man being in the same room a week before, today Dr. Ashley Bloomfield confirms genome testing proved the returnee was the first one infected and not the other way round.
The variation that the maintenance worker has means that he caught it from the person who was the case diagnosed in the managed isolation facility and who had travelled from the USA, and so that matches there.
Dr. Bloomfield outlined 2 theories.
It's possible it could have been a direct infection, or it's possible there could have been an intermediary. That's what we know so far.
To test how realistic each of those are, we asked Dr. Gemma Geoghegan, a virologist at the University of Otago. She says it's highly likely this strain of the virus came into New Zealand from the US returnee.
All evidence points to the fact that they did contract the virus overseas and brought it with them. So they tested positive, and now we have a second case of the hotel worker that is linked to this case. However, there is no physical link there.
Dr. Geoghegan says in general, the virus passing between humans is a more likely scenario than surface transmission.
Well, human-to-human contact is a lot more likely than contaminated surfaces. But, we are still learning a lot more about this virus, and to be honest, the evidence changes daily. So it's really hard to sort of estimate that at the moment.
Dr. Geoghegan says it's simply not known how long this virus can remain on any surface. There are too many variables. But she says it is quite possible there is a missing link yet to be found. A person or people infected by the woman from the USA who then passed it on to the maintenance worker.
There are a couple of plausible scenarios. One is that we're missing the links. So there might be one or more people that have been infected that we're missing, and serology testing will hopefully clarify that if possible.
Serology testing tests a person's blood for COVID antibodies, which would reveal if they had the virus in the past, even if they don't have it now and wouldn't be picked up by normal COVID testing. Dr. Bloomfield confirmed that work was already underway.
Even if they've got a negative PCR test, if they have evidence of old infection, that may help us make the link.
And the Health Minister is confident that despite the Rydges Hotel situation being different from the Americold cluster, officials have it under control.
It looks like we got it early. The testing results suggest that the person's infection was recent, so that's helpful. All of the tests of their co-workers have come back negative so far. All of those people are in isolation and they will be tested again. All of the tests of the person's close contacts, their family, their household, have also come back negative. So that's promising. It suggests that we got that one early enough.
It's hoped further testing could still find the missing link to the Rydges Hotel maintenance man puzzle. For Checkpoint, Logan Church.